Hi, my name is John Vasquez and I'll be doing my postpartum assessment with my cousin Carla. Do you give consent to this video?
Yes.
Okay, let's get started. Okay, can I see your wristband, please? Can you confirm your name and date of birth?
Carla Vasquez, 4399.
Okay, we're going to do your postpartum assessment today.
Okay.
I have washed my hands and washed the stethoscope, so we're going to get started. How are you feeling today?
I'm feeling pretty good, just a little bit tired and a little bit of pain.
Okay, where's your pain?
I'm down here in my downstairs area.
Okay, so tell me about your baby.
He's really healthy, he's really cute.
What's his name?
His name's Carlos.
Carlos.
Yeah.
Do you have a support system or someone here with you today?
Yes, my mom and my grandmother are here as well as my husband.
Okay, great. Glad to hear that. And assess your abdomen. Listen to your stomach. Can you stand up? Or just sit up for me, please? Just for a little bit. I'm just listening to your lungs. Okay. Stay seated for me. I'm going to check her CV tenderness. Do you feel any pain?
No.
Any pain?
Mm-mm.
Okay, lay down for me. So everything sounds good. Your lungs sound great. Your heart sounds good. I can hear your bowel sounds pretty good.
Okay, that's good.
Okay, so your pulse is around 76 beats per minute, and your respirations are normal. I'll also take your temperature. Her temperature is within normal limits. Okay, so now I'm going to ask you some questions about your breasts, okay? So,
Okay.
do they feel firm or soft?
Just a little bit firm.
A little firm. So have you had any symptoms of your milk coming in?
Yes, a little bit.
Okay, so how's baby latching? Have you tried latching baby yet?
Yes.
Yes, okay,
It's
everything's
worth
going
it,
good?
yeah.
Okay, great. How long is he feeding for?
About like 30 to 45 minutes.
Okay, and you're rotating
Yes.
both sides. Okay, great. So I'm going to check your uterus.
Okay.
So here I would just massage her fundus or her uterus. I would make sure I have one hand on her suprapubic pelvis and then one hand on top, and I would just kind of feel to make sure it's underneath the belly button. And then I would also check for any clots underneath around her vaginal area to make sure. I would look at color, consistency, odor. It should have an earthy smell, and it should not and it should be like a light yellow color. And so I'm going to ask her about her bladder and her bowels. So when did you last void? When was your last pee?
About an hour ago.
An hour ago? Okay, and you're using the hat?
Yes.
Okay. Your last bowel movement?
The same as well, like about an hour ago.
Okay, and was it painful or anything? Did you have problems going?
No, not at all.
Okay. And so now I'm going to ask you to turn to your side. And so here what I'm looking for is for any hemorrhoids. I'm also looking at her episiotomy. I'm checking for repairment to see if the stitches are okay, making sure there's no redness, swelling, ecchymosis, any drainage, and I could use a pen light to check also. I'd also check for approximation, and when she rolls over, if she had a C-section, I would check her incision for the same symptoms of redness, edema, ecchymosis, discharge, and approximation. Okay, so now I want to do the Human sign. So here I'm looking for DVTs. I'm only looking for tenderness and any warmth. Everything's okay. I will also assess for any edema. And I'm also going to assess your reflexes, okay?
Okay.
So just relax your leg on me. Okay, and that's fine. And then I would dorsiflex her foot just to make sure everything's okay. And then I did ask the patient about her emotions. I would assess her psyche. She does have a good support system here with her, and she's bonding with the baby very well. I'm also going to ask you, do you have any sweating or frequent urination symptoms, or?
I've been starting to sweat a little bit during the night when I'm sleeping.
Okay, I just wanted to make sure to tell you that it's completely normal.
Okay.
The fluid shifting in your body, but that should go over. It should be over about 3 days after postpartum.
Okay, that makes sense.
And so it's all normal unless there's a fever. Fever is no good.
Okay.
Okay, so let us know if you have any symptoms of a fever. I would also assess for any skin changes on her face. Usually on her face they get the mask, the pregnancy mask. I'll also check her stomach for the linea nigra and for any stretch marks. And I want to let you know about some diet changes that you might need to be aware of. So you want to increase fluids and calories because you are breastfeeding. And I want to make sure too not to lift anything heavier than the baby. So leave all the heavy work to family members.
Okay, sounds good.
And that completes my postpartum assessment. Thank you.